Um, Hello, everyone, and welcome to our November session of the Waste Management series. I'm just checking if our first presenter is here. He was having a bit of challenge in
Can you hear me?
Oh, wonderful.
This is Delfin. How are you? Yeah,
Thank you.
We made it work. We made it work.
All right, thank you. Yes, hello everyone, and thank you for joining for our November session, where we are looking this time at one of our private sector counterparts, and we hope to be having the colleagues also in the next couple of months, Abbott Laboratories, and they're going to be giving us their best practices for waste management handling. And we have two our subject matter experts, Delfin Rubin and Ami Soni. My colleague, David Bresler, will introduce them formally in a short while. We feel it's very important to engage our colleagues as for the past couple of months, 6 or so months, we have been talking about the subject, particularly when it comes to viral load waste and the components that are involved in these products that we use. So it will be one of the great things that we could do to bring them on board so that they could actually outline to us what is it that is involved when they are making these products, and what are their advices when it comes to disposing this waste. Without taking much time, I would like to hand over to David Bresler from the CDC to introduce our two speakers today.
Hey, Anafi, if you can give me just 1 or 2 more minutes. I'm parking right now, and once I get parked, I'll be able to introduce it. If you can give me 1 or 2 more minutes. Great. Anafi, can you hear me?
Yes, I can hear you, David.
Okay, just give me another minute. Another minute.
Delfin, can you share your opening slide?
Yes. Let me jump into right. Let me go do that right now. Okay. So to do that, to do this here. Can you? I'm sure you can see my screen, right?
Yes, we can see it. Thank you.
Okay. I have this notice here. Do you want to continue? Got that. Okay. I'm always afraid of those little windows that pop up. It's like, oh, what is that? What does that mean?
Wonderful.
Okay, Nafi, I'm just about parked. I can do the introductions now, I think. Everybody hear me?
Yes, we can hear you, David. Go ahead.
Okay, let me just go over to my capture of everybody's bio. Okay, so as Anafi mentioned, this is Dave Bresler. I'm going to be introducing our speakers, and really this is an opportunity for everyone to hear from a manufacturer's point of view the same concerns that we may all have regarding waste management, and in particular, this time we're going to get another viewpoint from another high throughput platform manufacturer, Abbott, and we will hear what their take is on the viral load waste management situation. So I'm going to introduce Delfin Rubin as our first speaker. He is a global marketing manager for the HIV care portfolio at Abbott Rapid Diagnostics. Prior to being at Abbott, Delfin was the EU marketing manager for mid-volume instruments. Delfin has spent the majority of his career in the pharmaceutical industry, where he has held various diverse roles. Delfin has an MBA from Western Michigan University and a BA from Western Connecticut University. In addition to Delfin, we have another Abbott leader and speaker. Her name is Ami Soni, and she is the Environmental Health and Safety Lead for the Abbott Molecular Division. And they are headquartered in Des Plaines, Illinois, here in the U.S. And she has been with Abbott for about 5 years now, where she has promoted and championed the programs ensuring a strong safety culture in the workplace and environmental compliance. And so with that, I will turn it over to Delfin.
Thank you. Again, thank you everybody for giving us this opportunity to be here. Hoping that we can share some of the a new piece of information that can actually be relevant for the work that you guys do. And so for starting, so what I want to see if I can move my deck. Here you go. Okay. So here's the agenda. So I'm going to go talk a little bit about overall about the organization, what we call the 2020 goals for Abbott. The EID market and the viral load market. I know the subject line here is viral load, but the EID market also, according to the CHI report, it's a market that is going to grow as well. Then we're going to dive into the source of instrument of waste, the viral load and the detect for EID market, and double click, I will say, into the data sheet, data safety sheet for our, and how do you handle those things. So as a disclaimer, like anything else in life, you know, the content that will follow is general, and that each facility is obliged to follow the national and international guidelines. The material being presented today is only for November 7th, this session, and the information, as you know, it continuously is updated. So I always recommend to go to our either IFUs or our website for the most up-to-date information. So going back to Abbott, and so Abbott as an organization is a very big in different business units, as you might know, for molecular, diagnostics, cardiovascular, diabetes. But as a company, back in 2010, created a baseline in what they called it 3 goals for the 2020: reduction in CO2, reduction in total water intake, and reduction in total waste. And this is total waste in our side, in what the waste that we do to manufacture the products and that we provide. And so when we get into 2018, which is last year, the number for this year will probably come up towards early next year. We are really right to achieve these important goals. And in 2020, they're going to reset it for 2030. So as you can see, as an organization, the commitment for waste reduction is across from the development, the manufacturing, and what we're trying to do to give to our customers. And this this lead us to where the organization stays among the other companies in this industry. So when you think about the Dow Jones Sustainability Index, we're the global leader for 6 consecutive years. On the corporate citizenship, we're on the top 100 for 11 years, and the leader in the healthcare industry in 2017. We are included in Change the World list in Fortune magazine, and it should not be a surprise that as an organization, we are #1 in social responsibility in the healthcare industry, Fortune magazine. So again, this is just to show you a little bit of where the organization is as the umbrella, and what BU is always carrying this into it to drive the big objective. So now let's talk a little bit about where we are here, right? So we know, based on the 90-90 goals on the HIV, there are going to be a major growth, as we know, the viral load test, but as well, we believe the EID will also carry an important growth. And as you can see, they are what we call the action forecast demand, and it's almost going to double between last year. This is CHI data from and to all the way to 2023. So it should not be a surprise why you, as an organization, is looking to how do we going to be handle all these waste stream, right? From all the numerous tests that are going to be thanks to the objective from the 90-90 and getting access to patients through different technologies. But before we start into the ways that the point of care will generate, I'm not sure how many of you know about the point of care instrument that we have called mPIMA. This instrument is perhaps the smallest PCR in the marketplace. It was designed intended that way. Most likely you will see it more in non-laboratory settings as opposed to laboratory settings. As you can see the dimensions, it's about the size of a shoebox. It can only do one test at a time, and it can do only two different tests, the one that we call the detect and the one that we call viral load. One only carries the detect 25 microliters, and the other one only carries 50 microliters. And so this is an instrument that we call a true point of care. It was designed to put it right where the physicians and the patients are for a quick response of the need for knowing either viral load or number of copies, or the detect, know if it's positive. No. The detect, you probably heard in the marketplace with the ECPAF study that was done part of the EID, the early infant diagnosis. So now when we look at this instrument, and it's being designed to be placed across different settings where perhaps the most vulnerable patients or maternity wards or mobile units, it was designed well, not only because of the portability, but as well for what the type of waste is going to generate, right? Which is the topic that we are here. So when we break down the waste generation from the utilization, you only have two pieces: the pouch, which is all made of aluminum, and if it's not contaminated, this should go right into the recycle for metals, aluminum, or cans, or whatever you have as a recycle for this type of material. When we talk about the test in itself, the test is made out of polypropylene, which is plastic number 5. For those who know, this plastic number 5 is perhaps the plastic that is the most common use in industry, the food and the beverage industry. And it's fully recyclable if it's not used. And that's a key part to have in mind. These tests can actually be fully recycled if it's not used. Once it's used, then it becomes medical, it's contaminated, and it's medical waste. When we look at the test in itself, I wanted to give you a sense of what it is. It's just plastic with no filter, lysis, the microarray. That's where we actually read the laser. We measure either the positive patients, HIV positive, or the number of copies. This cartridge only weighs 19 grams. And depending on what test you're using, is again 25 or 50 microliters of blood. When we open these into the composition, and which actually brought us more here, I want to highlight your attention in two important elements. Again, we designed this instrument to be out there in multiple settings. And so one thing that we can count is that what the waste is going to be generated. So we do have guanidine, but we have guanidine HCl. It's no GTC. And therefore, this is perhaps one of the biggest achievements when we think about the novel instrument for portability of point of care, right? It doesn't require a special waste management because of the absence of GTC. The other component that perhaps could actually have your attention is the sodium aside, and it's very minimal. It's less than 0.1. So the other elements is not, I was informed that that's not relevant from an environmental standpoint, right? When for the disposal considerations, and this is a little bit more like the general view, as I said before, for the packaging, is disposed, is recyclable, it's aluminum, if it's not contaminated. When the cartridge is being used, it becomes a biohazard waste. Without GTC, it's just regular medical waste with any other medical waste that you generate and you treat in your waste stream. Because the EID market is going to grow, the detect cartridge is going to be used. And again, with the same concept, this was designed. I'm going to grab your attention right into guanidine HCl. That's the good side of the guanidine. We do know this test also does not have GTC. And also the sodium aside is very minimal, it's less than 0.1. So when this test is what is used, it becomes medical, it's contaminated, and it's just managed through the regular medical waste. Again, for disposal considerations, packaging is aluminum, not contaminated, recycled. The test, just regular waste. And I think we heard that was very important to keep highlighting these as it doesn't incur any additional costs, especially when it's a point of care, different settings, and the waste generation doesn't have to be separated because of the absence of GTC. With that said, that's my part. That's the part that I wanted to get you guys introduced to this technology, the instrument, how it was designed. And I hope also give you a little sense of how as an organization, we're looking into not only from a technology and getting access to patients, their information, but as well the impact that we do by the waste that we generate as a company and as the products that we build with novel technology. So I'm gonna, I think we'll leave the questions towards the end and let Ami continue.
Yes, thank you, Delfin, for that introduction. Delfin is from the Rapid Diagnostics side, and as you have noticed, he talked to us regarding the point of care instrumentation that they have, the chemical components that are in there, and he mentioned some, I think he will definitely have some questions around what components are in there as they come through. So we welcome Ami, as David had introduced there. Ami is coming in to talk to us from the molecular conventional instruments, I guess, Abbott. I think most of us do have the most of the Abbott M2000s and similar instrumentation. Ami, please go ahead and share your slides. Ami, are you there?
Yes, I'm here. 1 second, I'll share my screen now.
Thank you. Just as Ami is sharing her slides, kindly enter your names and organizations in the chat box. If you are more than one behind a station, kindly enter all the names of the people with you there. I can see our DRC colleagues, Apolineki Lundu and company, you have entered them. Thank you very much. Ami, over to you.
All right, thank you, Anafi. Good morning, good afternoon, everyone. My name is Ami Soni. I am the EHS Lead for Abbott Molecular. So Abbott Molecular is a business unit of Abbott as a whole, and we are a leader in diagnosis and monitoring for infectious disease and oncology. And today I will be covering the waste management best practices regarding the instruments which we supply, which is the M2000 and the Alinity. Okay, so moving on to the agenda for today. So we will cover the Abbott Global Sustainability Report briefly, and then we'll move on to different sources of instrument waste that is generated, and the waste handling and disposal processes, and the WHO recommendations. And lastly, we will end with the waste management in developing countries. Moving on, at Abbott, sustainability is integrated into everything that we do. Wait, why is this moving? Okay, everything that we do around the world, delivering positive economic, social, and environmental impact for many people which we serve. Which brings us to our Global Sustainability Report. So this is a report that is published annually, and it is available on abbott.com for public access and viewing. So within this report, there is a section dedicated to safeguarding our environment, which covers our short-term, long-term goals pertaining to the environmental waste, water, and energy conservation. And briefly regarding the waste, you will see that we have our 2018 waste projects and savings shown in the illustration. And at Abbott, so Abbott is committed to minimizing our waste impacts throughout the entire life cycle of our products and packaging. So we recognize that there are two key areas of responsibility in reducing waste. So the first is the operational waste. So this includes waste which we generate as a company directly. And then the next item that we like to focus on is our extended producer responsibility. So this would consider any environmental impacts associated with our products throughout their entire life cycles, including the design, production, consumption, and disposal. Okay, so to the figure to the right, it includes that in 2018, we had 9 major waste efficiency projects, which we completed, which were covered in 5 countries and 9 different sites, which resulted in $17,000 total of annual savings. But most importantly, we were able to eliminate 3,722 U.S. tons of waste. Okay. And if you would like to see further information on our global sustainability efforts, please go to abbott.com and view our report. Okay. So next, moving on to our company statement. So the next part of my presentation will cover specific waste management practices pertaining to the 2 instruments, that's the M2000 and Alinity. So it is important to note that the content that will follow is general and that each facility is obliged to follow national or international guidelines for the management of the biomedical waste, and that the material being presented is only intended for this session of ASLM for November 2019, and that information is continuously updated and should not be used as reference after today. This brings us to our sources of instrument waste. So in this slide, you will see that we have various sources of instrument waste, which is the solid and liquid waste generated from the instrument. And then we have waste from the lab, such as specimens, tubes, and tips. So what's important part of this is that these are top sources of molecular contamination. And it is important that we segregate these wastes accordingly to avoid any error in data sampling, contamination of the instrument, and the work area. And we will dive further into what these actually are in the slides which will follow. Okay, so next, regarding the sources of instrument waste, the top photo is of our waste drawer for the M2000, and the bottom is the drawer for Alinity M. And the number 1 points to, for both of the instruments, the solid waste container that we have, which will collect our pipette tips, which are contaminated with infectious waste. And number 2 illustrates the liquid waste container, which is collecting any waste from the reagents, patient samples, and just different particles of the instrument that are generated. Okay. Moving on, so what is actually in the waste, liquid waste? So this is the information directly from our SDS document. So part of the M2000 instrument is our Abbott M sample preparation system. So that includes these 5 bottles shown here, and the substance of hazard which are included in these bottles are guanidine thiocyanate, polysorbate 20, and trimethamine hydrochloride. And out of these 5 bottles, if you look closely, they will have a hazard symbol indicated, which means that any of these substances could be included, and it is important to note that there is a hazard associated with it. Same thing with the bottles shown to the right for Alinity M. So these are 4 solution bottles. There's one called the lysis solution, which includes guanidine thiocyanate and trimethamine hydrochloride. The ethanol solution has ethanol 100%. The diluent solution has 2-methyl-4-isothiazylene 3,1. And the vapor barrier solution does not have any of the hazard substances. So these will also be marked with the hazard symbol. Okay. Moving on to our solid waste. The different types of solid waste which will be generated from both the instruments, which will be various tips, the deep well plates, PCR plates, reaction vessels, master mix tubes, caps, empty reagent bottles. So it's important to note that this waste is biohazardous and should be disposed of accordingly. Okay. And then we have our liquid waste. So various types of liquid waste that you will come across from the instrument is the first one, which is the system waste. So that's the waste generated, we mentioned, from the instrument that is collected in the liquid waste container. The second could be any unused reagent bottles that you may have remaining, whether it is expired or you didn't use and you need to discard of them. they do need to be discarded as hazardous waste. And the last item is the remaining reagent solution from instruments. So any of the instrument runs that you completed, this is the liquid that is left over that will also need to be disposed of as hazardous waste. Okay. Next slide. So waste handling and disposal are most important discussions. So we will cover the guidelines for disposal of various waste categories we just reviewed. So you want to make sure that you decontaminate and dispose of all specimens, reagents, reaction plates, and other potentially contaminated materials in accordance with local, state, and federal regulations. And all used and contaminated materials should be handled and disposed of in a manner that minimizes the chance of potential RNA and DNA contamination of the work area. And last important point, which is that oxidizing agents such as sodium hydrochloride should not be mixed with any of the reagents or any of the liquid waste bottles from the instrument. So this can generate toxic gases from the mixtures and can lead to pressure buildup in the container. Okay, so autoclaving is not recommended for materials contaminated with products that contain chemicals that are hazardous by inhalation at low concentration. And autoclaving the sealed reaction wells will not degrade the amplified product and may contribute to the release of amplified product by opening of the sealed wells. So the laboratory area can become contaminated with the amplified product if the waste materials are not carefully handled and contained. So the used PCR plates that you have need to be placed in sealed plastic bags before proper disposal. Okay, and to note down, it is a responsibility of each facility to characterize its own waste streams to ensure that waste is disposed of in accordance to applicable waste regulations. Right? So what if there are no national regulations? What should nations, countries, and people be doing? So it is best recommended to refer to the WHO Handbook on Safe Management of Waste from Healthcare Facilities. Is provided including planning, budgeting, and training. So the WHO Handbook is a great resource. It includes the different types of options available in waste disposal, how to segregate the waste, the different containers which can be used, how to label the waste, and the color coding processes. And this is available to everyone, and it's public data. All right? So what does the WHO actually recommend? For hazardous waste, it should not be discharged into the wastewater, but collected separately and treated as chemical healthcare waste. Also, it must be labeled with the type of waste, the name, and the major chemicals which are included, and it must have the hazard label. So whether the substance is a corrosive, flammable, or explosive must be clearly indicated. And based on the hazard class, it should also be segregated accordingly. And for sharps waste, it should always be stored in puncture-proof containers. And for infectious biohazardous waste, it should be stored in strong leak-proof plastic bag or container. Okay, and this is all directly from the WHO handbook. So waste management strategies in developing countries. It is advised that entities consult with local authorities to establish independent guidelines pertaining to handling and disposal of waste. So in Uganda, there is a national environmental regulation, SI 153.2, which includes list of licensed waste handlers, which can transport, process, store, and dispose of the waste. And Kenya has Waste Management Regulation 2000. I'll repeat myself. For Kenya, there is a Waste Management Regulation 2006 published by the Republic of Kenya, which lists the requirements pertaining to the handling and disposal of waste. This concludes my presentation, and I hope everyone was able to gain further insight into the best practices for waste disposal.
Thank you, Ami, and Delfin for the presentations. I'm sure there is quite a lot of information that we got to learn that we were not aware of. And I can see questions are there in the chat box, and soon we'll be jumping into these questions. It is important for us to really know what is it that we are dealing with and how we dispose them. So I have my own questions, but I'm going to be a good host and let the other questions be answered first, then I will ask last. So Nicholas, I think should be ready now to get into our Q&A session for the presenters.
Yes,
Nicholas, over to you.
Yes, thank you very much, Anafi. Thank you very much, Anafi. There are a couple of questions in the chat box. The first one is from Maria Rose, and she is asking, you say unused cartridges can be recycled. Does this mean expired cartridges can be returned back to the supplier or manufacturer? Once again, you say unused cartridges can be recycled. Does this mean expired cartridges can be returned back to the supplier or manufacturer? Yeah, I think this goes to the first presenter.
Yeah, so I tried to address that in a later part of the chat. So yeah, again, so the cartridge is mainly made out of PP, which is number 5, but it is not, each country will have policies in how to recycle the different type of plastic. So we can only, based on the guidelines for number 5, each country will have to double click into it. And it's not meant, the whole idea is not meant to return it to the distributor or the manufacturer. You know, you just have to use the simple due process of it's expired, just manage it through your, if your local authority have the ability to recycle, or if it's not, just to regular trash, not contaminated plastic.
Okay, thank you.
Hope that answers your question.
Yeah, the other question is from Collins, and he is asking 2 products from Abbott, one with GTC and another without. Is it possible to transfer the technology from Allele to eliminate GTC? Once again, there are 2 products from Abbott. One has GTC and the other does not have. Is it possible to transfer the technology from Allele to eliminate GTC?
Well, I guess I'll take this answer. I think the short answer is that the way we constantly share our technology, right? So we recently, 2 years ago, but we got part of the grand family of Abbott, and so they are constantly looking for opportunities to learn from each other, not just because it's rapid diagnostics, but we also learn from other business units. So we do cross technology, and sometimes it's possible, sometimes it's very difficult because of the design of the product in itself, right? So if you think about our point of care, it's just one test, takes 70 minutes, and you get your number of copies right there. The instruments that come from the molecular side, such as the M2000 or the anility, there are primarily laboratory settings, right? So there is pros and cons with volume or point of care, but rest assured that the organization is always looking for cross-sharing technology when it's possible, especially when also as well touches some of the goals that we have mentioned early in the presentation.
Okay, thank you very much. As the questions go on, if there are any other stakeholders or members that want to raise any question, raise any comment, kindly feel free through the moderator. You can raise up your hand and the moderator will give you a chance. The other question from Maria Rose still is how much liquid waste is generated per batch? How much liquid waste is generated per batch? Thank you.
So the amount of liquid waste.
If you ask, okay. Please go ahead.
Hello.
Go ahead, Amy. We can hear you.
Yes, so the amount of liquid waste generated is dependent on the batch size, but we can get back to you on this question on exact amounts.
Hi, this is Kat. Can I actually answer that question?
Go ahead, Kat.
Hi all. For viral load in EID testing on the M2000 platform, you generate approximately 20 liters of liquid waste for every 200 samples processed.
Thank you, Kat, for jumping in. I hope that answers Maria.
Okay, thank you very much. Back to you, moderator. Those were the questions in the chat. I don't know whether Kat would want to clarify more on the comments she has written in the chat. It's a little bit a long one that may need some verbal raising and clarification. Kat?
Thank you. So I just wanted to, first of all, thank the guys from Abbott for their presentations. They were very clear and I really appreciate the time that they've taken. I just wanted to note for people who are not frequently using these platforms in the lab that the solid waste from the M2000 platform, we also have to think about the reagent vessels themselves, which is a lot of plastic. And as we move towards the alinity, they use a lot of IRUs, which is where the reaction takes place. And that is a lot of plastic waste that we need to consider. And that actual IRU would be considered as infectious waste. I also just wanted to ask a quick question. Since the WHO handbook does not cover any information specifically for GTC containing waste, I just wanted to know what Abbott recommends once the waste has been segregated into an appropriately labeled container. Thank you.
Thank you, Kate. Over to you, Ami and Delfin. Would you want to react to that?
So we recommend that you dispose of that waste according to your state, local, and federal regulations, which can vary by various regions.
Hi, Anafidis Clement.
Please go ahead, Clement.
Just a couple of points. I think the manufacturer needs to help us to understand what this waste actually truly are. I mean, because we're saying local and regional guidelines, there are no guidelines. I mean, we expect WHO and the manufacturer to provide that information. So I think the manufacturer probably order to the community to provide that. And then second, what we would also like to hear from the manufacturer, what's the safe way to dispose this? I mean, we're expecting manufacturers to actually provide some contribution. These are byproducts of the weight of your product. So it will be important for you to help the community to know how is the best way to dispose that. Either we have help WHO to develop a guideline, that's one, and then two, some contribution from the manufacturers on end will be very helpful. And thirdly, we used to have other harmful products in the past, and that has led to this creation of a real-time PCR, so like ethidium bromide. So I think long-term, the question that was asked by Collins, I think it's an important question. Maybe not now, but give us some time frame that the manufacturer is going to be looking for safer chemicals in the future.
Thank you, Clement. Ami, Delfin, any reactions?
Hello, yes. So currently we cannot specify a particular time frame, but that will be something that we'll discuss with the team, and all the points are noted down and we will get back to you.
Thank you. I would like to call upon our colleagues from the country teams, the ones on the ground, if there are any concerns or questions that they do have regarding, I think, mostly the products in question today, which are the Abbott products, the M2000 mPIMAs, Alinity, to share, I think, any of their experiences with them. Whilst they are doing so, I just want to add also my a few points on the need to really like as a call for the manufacturer to sort of also lead the way, particularly where there are no guidelines. And I think you are also in a better position to know which kind of products are in there, to sort of even give a rough guideline of how best or the recommended ways of disposing these. As we have just seen, I think the WHO guideline doesn't have, I think, some of that when it comes to the GTC. So even a small, I think, even if it's a small brochure or a guideline on how this can be done for countries. And then I think we also know clearly, we both agree, and we mentioned that the chemical waste shouldn't be autoclaved, neither should it be thrown down the drain. But we know definitely this is what is happening in our countries. And I think we need to get to a certain point where we work together and see how we will be able to stop this. Particularly, I think when we think of installing instruments, and I think how do we dispose the waste should be, I think, one of the questions that comes forefront. There was one question, I think, if I missed it, somebody asked from the audience that what sort of containers are supposed to be used. Was that answered when it comes to collection of the waste? Nicholas.
Yeah. I also want to ask a question. From what Katie said, that 200 tests would generate waste of about 20 liters. Does this whole volume contain GTC? Because that would be quite big volume. Is there a way that that volume can be, within the processing compartment, I think there is a point where you can disaggregate between the GTC containing waste such that the volume reduces and the waste that doesn't contain GTC, the liquid waste. Is there a way to reduce that volume? Because 20 liters per 200 tests would be great volume, especially for high volume labs, if they have to maneuver how to deal with this volume of waste that contains GTC.
Thanks, Charles. Any reactions?
So Charles, this is Kat from CDC Atlanta, currently in Cameroon. Currently, as the instrument, the M2000 is set up, there is no way from a user point of view that you can separate those solutions. But yes, that whole volume does contain GTC, and depending on how many extensive flushes the user utilizes between each run, it can vary the concentration of GTC, because the wash buffer on the instrument is just water alone. So if they do more washes, then the volume would be greater. That is just the bare minimum processing volume, along with one daily maintenance with no extensive flushes. Thank you.
Thank you, Kate. Nicholas, okay. There are two questions in the chat. But that is coming at a follow-up question.
Maybe to get back to Katie, I'm not saying in terms of some running the test. I'm talking in terms from the manufacturer's end. Would they find a way, if they can, to reduce by dividing the waste that contains GTC and that which may necessarily not contain GTC, so that all of them don't drain in one container? I'm asking from the manufacturer's point of view.
Ami and Delfin, this is directed to you.
So the design of the M2000 instrument does not separate the waste as indicated. It just doesn't allow it currently.
Noted. Thanks.
Okay.
So I have a follow-up question to what Kate had mentioned, and it's one that may be pertinent for many of us. Is there a standard way of being able to estimate this volume of waste that can be shared to colleagues so that they can be able to do that on their own in their various labs. Katie.
So this is just from testing at headquarters, where we have run a known number of samples and collected the waste just from those samples. So we know that the waste container is pretty much full after running 200 samples. And when we transfer it into our waste collection, it's approximately 20 liters of waste. Okay. And when I say 200 samples, it's not really 200 samples because it's 2 full plates. So it's just under 200 samples.
Okay, thank you.
I don't have that data available off the top of my head, but it is a lot less, the liquid waste. The volume is a lot lower.
Okay, thank you very much.
You're welcome.
Nicholas, over to you. There are 2 additional questions in the chat.
Okay, thank you very much, moderator. The other question in the chat is from Takuduzua and from CDC. And she is asking, should waste disposal cost be bundled into the reagent cost like instrument servicing, so that manufacturer take active responsibility for the hazardous liquid waste produced by the machines and actively work with labs to ensure that it's disposed of accordingly? Once again, should waste disposal costs be bundled into the reagent cost like it is done for instrument servicing, so that the manufacturers can take active responsibility for such waste to be actively managed accordingly?
Over to you, Ami, Delfin. Any reactions?
So that point will be noted, but I cannot take a stance right now. That subject will be actively discussed with the team.
All right. So in other words, I think this is open to discussion. All right. Thanks.
Okay. Thank you very much. The other question from Stuart is, what is the lethal dose of GTC from viral machines? What is the lethal dose of GTC from viral machines that can cause harm? Yes, Rubin or Ami? Any comment on this?
Sorry, please repeat that question.
Okay, he is asking what is the minimum dose of GTC that can cause harm to human beings? Do you have you done any research about GTC? And maybe you have some research indicating that if you have these amounts of GTC maybe in the environment or someone is exposed to them, they can get harm. I think it's what he's asking.
This is another item that we will be discussing and getting back on. I do not currently have actual data with these.
Okay. Also, the question on cartridges, you can recycle cartridges, I think was not properly answered. Somebody was asking, if cartridges are expired, can they be returned to the manufacturer for recycling so that they can be reused by the manufacturer? Or you're meaning recycling into general plastics? Is it possible to be returned to you so that either the country gets some concession on the next batch because they gave you this one to recycle and reuse? I think that was what the one who asked wanted.
Okay, so let me try to be as clear as I can on this. I think it's important to know this, and I think it happens across the different cartridges, either recycle or not. We'll do our best through our distributor channels to make sure that you get the cartridges with the longest shelf life possible. But we do recognize that sometimes they could actually get into the expiration date. We will not recommend it, and it's not currently on our processes, to receive those cartridges back for a lot of different reasons, because remember, the manufacturer is not on your local market, and so the amount, when you think about energy waste in making it and recycle them back to the manufacturer, is a lot greater. So when you think about energy waste, right? And so it's always the best always is to get to the closest to put it on the waste stream as possible. And so my recommendation, again, this is not to resend it back, but what the good news is, it's not a medical waste thing, and it's just a part of your regular. If your country does recycle, investigate. It's unfortunately that this changes country to country, but with all categories, as category 5, the PP, and so you will have to contact your local waste management to see if they do it, and if they do it, they will give you spatial location. Otherwise, it's just regular waste, plastic number 5. Hope that answers the question.
Okay.
So, Nicholas, there's a question that was asked around the lethal dose by Stuart, and I just pulled out one of the presentations we had last year, which talked about, I think, the LD50 values, just for your information, around 1.53 milligrams of body weight for a 70 kg person. But I think they, I don't know whether they are MSF colleagues on the line. What they found was that I think the amount of cyanide that is in these chemicals is way much more than what we have, I think, for these experiments that were done, and that what is shown in the some of the data sheets. I just wanted to share that.
Okay, thank you very much for sharing that. We have a couple of more questions in the chat. The other one is from Kat. Would it be possible for the manufacturer to add a label to the instrument waste containers as a reminder about not mixing the waste with breach-containing compounds? Once again, would it be possible for the manufacturer to add a label to the instrument waste containers as a reminder about not mixing the waste with breach-containing compounds? Yes, Ami and Rubin.
Hello, so this information is included on the operations manual of each of the instruments, and it should always be referenced within that document.
Okay, thank you. The other question from Nora, Nora Vera is asking, is Abbott considering building capacity for waste management in resource-limited settings, given the huge number of tests that will be done in the next few years? Even simple support as helping with design of incinerators that can handle waste can be hopeful. Yes, Ami and Rubin.
What I can say, and I think this is just speaking in a broader view from Abbott's standpoint, right? When we're looking into these type of settings, and these are great places to get interaction with different stakeholders that we work with. We are constantly getting these, and we are always looking for opportunities to partner better for certain things, and this perhaps could be one of them, right? And I think we could actually sit down and subsequent and to evaluate the different opportunities, what else we can do to complement the work that you do besides just maximizing our technology, right? So I think the broader response is that it is clear that we do recognize that there is an uptake on the viral load. There's going to be an uptake on the utilization of some of these technologies. Some of them have some exposure to critical waste, and there might be an opportunity to partner to look for better solutions to handle this in a more sustainable way, right?
And maybe the last question from Janine is, how long could the used reagents be stored in the lab before incineration? In this case of long-lasting storage, what can be done to secure people around? Once again, how long could the used reagents be stored in the lab before incineration? In this case of long-lasting storage, what can be done to secure people around? And the other last important one from Maria Rose is she strongly recommends that cartridges have a longer shelf life, as this is becoming challenging to so many countries. So is it possible for these cartridges to have longer shelf lives so that they don't expire so fast? Yeah.
I am trying to understand the question a little more. You're talking about the cartridges for the point of care type technology? How long?
Yeah, there are two questions, but I read them together because of time. The first one is how reagents can be stored in the lab before incineration, and the measures that can be taken to ensure that the people are safe. And then the other one is whether it is possible for the cartridges to have a longer shelf life, since their short expiry is always challenging to countries.
Well, let me take a stab at the last part, which is very straightforward in the sense that we continue to do investment in R&D to extend the shelf life, because if you feel it's challenging, you have no idea how challenging it is for us. Sometimes we feel like we're going through miracles to get this as soon as we manufacture. So have in mind, we manufacture these cartridges in Jena, that's central Germany, and it gets then shipped to our warehouse in Amsterdam, and it gets to the different centers and distributors in Africa. And so there is a gigantic effort in the organization to get this as quickly. So when we launched the viral load, it came out with a shelf life less than the current one. Now today it sits in 10.7. And we continue to invest to extend that, because we know this is not only a challenge for us, but as well for our customers. So rest assured that we're focused on these type of things.
Right. Yeah, we left with only 2 minutes to time. I know there are quite a number of questions that keep on coming in the chat. So what we'll do as usual will be to compile these questions, send them to Ami and Rubin, so that they can respond, and then we share. Our chat will always continue active on the WhatsApp group, so you can feel free to add more questions as they come, as we try to round off. One quick one would be, you mentioned that there are waste efficiency projects that we have done in countries. I think this is quite interesting, and we would want to know maybe the extent at which you hope to expand this to at least every country that does have some of these products. So in 30 seconds, I would like to give you Ami, and then 30 seconds to Delfin to just quickly give your last remarks. Ami, 30 seconds.
Sorry, I had to unmute myself. Thank you, everyone. I really appreciate everyone attending, and it was my pleasure to educate everyone on what we consider as best waste management practices, and the questions addressed will be discussed with the team.
Thank you. Delfin?
Hi, thanks again for your time today. It was, I always take these opportunities to not only to share our technology and what we can do to drive with our customers, the engagement, and also I take this opportunity to learn from you guys. And I can see that there's a few pain points that, despite the fact that we continue to invest in novel technologies, there's certain things that there need to be a little more work to be done on it. So we're gonna go back and try to invest more on this area so we can continue to support you as a key customer for our relationships. So thank you for your time today.
Thank you both, and on behalf of the ASLM and CDC teams, I'd like also to thank you for coming through and sharing with us what your perspectives are. I'm sure there are questions that still need to be answered, but it was clear, I think the countries and ourselves need guidance really particularly where this is lacking as we move forward. And I think we look forward to, I think, better and more, I think, increased engagement as we look to work together to really fight this. I see Charles wanted to say something, and Collins as we round off.
Okay, just a reminder of us who left off the face-to-face meeting with some assignments on the action plan and the hashtag. Please be making progress on this piece of work that still remains. We would need a feedback from you on the progress and the final product. Back to you, Anafi.
Thank you. Collins, you have anything to say?
No, just to thank everybody for participating in a good discussion. We hope to further engage manufacturers.
All right. Nicholas?
No, thank you very much, everyone, for the wonderful discussion. And like the moderator has said, the discussion is continuing on WhatsApp. Thank you.
Thank you very much. What is left for me is to thank everyone for participating in huge numbers. And as usual, we will continue to share and hopefully we continue to get the answers that we are always seeking. As Charles mentioned, we are going to follow up with you on the outstanding issues that we had from the LabCoP face-to-face meeting a fortnight ago. Thank you very much and have a wonderful day. Bye.
Bye bye.
Bye bye, everyone. Thank you.
Bye bye. Bye bye, everyone.
Bye. Bye.